Hey, welcome to the Pulse of Healthcare. This is your host, Dr. John McCormick. I'm here with my friend Peter, and we are going to talk a little bit about steerage. What a horrible word. We hear that all the time. People talk about, I don't want to go there, or, my network is making me do this or that. But we don't understand that sometimes, when we're talking about steerage, that's a good thing. It's actually in the best interest of the plan, of the member, of the employer, kind of all the above. And whether you realize it or not, whether you have an HMO, which is a very tight network, or a limited network, or a much broader network like a PPO, you're being steered one way or another to different providers and different hospitals. The real question is that good for you? What do you think, Peter?
It's one of those phrases that I've heard a lot of, and I changed the word from steerage more to a referral because when you go to a general practitioner, they refer you to a specialist. That is steerage in its form, and it's in the customer's best interest to follow that steerage to that specialist. The customer really has to take a look at how they evaluate what the referrals are for them. And when they see that it's in their best interest, then they can move forward and work with the company like us who steers them to the specialist or the best practice.
And say, I think you just made the point right there, right? So let's say you're in one of these major medical plans and you've bought their really expensive PPO wide open network, and they say you don't need a referral as long as you use a doctor in the network. Well, hold on a minute. If I'm using a doctor in your network, then they're pre-approved, and you're basically just steering me, right, to a doctor you've already pre-approved. But there's something missing in that equation. First of all, how come my plan's more expensive than somebody else, right?
Right.
Probably 20-30% higher, right? Because what you're doing is creating up a false impression of choice in my mind. I really don't have a choice. I still have a list, right? But it's missing something that's really important to me in the healthcare field. It doesn't tell me how good the doctor is. It doesn't give me a real value proposition. So if you're sending me to a cardiologist, right, and he's on your list, and I go, oh, that cardiologist, and why did I pick him? Oh, because he's close to my house. Does that mean he's a good cardiologist? No. Does that mean he's going to charge me a fair price? No.
Maybe.
does that even mean that he's the best cardiologist I could go to within my plan? Probably not, right? So this is one of those things where a lot of times we engage in consumerism. I talk a lot about this consumerism in healthcare, right? And how we don't engage in healthcare like we do anything else. If I set you in front of in the grocery store and you had a range of products that were all the same, right? And you had this brand name and that off brand and that store brand, and you were right down the list. And you looked at them all and you went, oh, I'm going to buy the name brand because I like the name brand. I'm sold on it. But the store brand is exactly the same. It even tastes the same, but it's 50% less. Well, if you knew that, you'd probably get the store brand, right?
Right.
The difference between a product like that and a product that's a service like is being provided by a doctor is that you can't evaluate them that way. But guess what? We can, and we do all the time. That's why it's so critical to have a partner TPA plan like Ovation Health that actually not only knows what the other services are out there that you need, but who's doing it best. Who's doing it best? Because sometimes we're making a convenience decision instead of a quality decision. And I know if I'm having medical work done, give me quality.
I know that most people that talk about steerage are talking about it with the doctors. It's also two different facilities. I went through an experience where I was referred to a different hospital because they had more capabilities in the area that was the specialty that was being done. So if we'd gone to a different hospital, the capabilities, the number of surgeons that could help, as well as the hospital's facility to support those types of surgeries, is mandatory. So
Right.
I was just basically said, don't go there, go there.
And what was probably too invisible to you was the cost. Because a hospital specializes in certain procedures or has better staff, believe it or not, generally the costs are lower. So sometimes you can go to one of these, I'm going to call them big box hospitals, name brands, and that doesn't mean they have the best staff or the highest quality staff, but they sure can charge the highest price. And we've done other shows about that where we've talked about, if I go to hospital A, the procedure is $20,000. But weirdly enough, 3 blocks away at hospital B that has a better staff, it's $3,000. Why is that? Well, hospital B does 40 of these a day and is staffed and equipped and trained and can do them like this, right?
Yep.
Hospital A, not does 2 a day, not as well staffed and equipped, and they charge a lot more. So you spend more time there, and subsequently your expenses go up.
I think if people, instead of using the word steerage, use referral, they'd be a lot more comfortable and understand how the referrals are being made and why, to their benefit.
And I think, there's a lot of referrals kind of getting slimed too, but there's a lot of things about referrals. And so I'm going to wrap kind of with this kind of thought. All right? Referrals come in a lot of different forms. Just because your doctor says, go see this specialist, again, doesn't mean it's the best specialist, doesn't mean they're going to give you the greatest service. Doctors generally refer within their circle of associates, right? That doesn't make them the best practitioner in the city or in the county or in the state, all right? It doesn't. It's just somebody they know. And it doesn't mean they're not great, and they may be, all right? Plans refer within their networks. Again, the broad networks like PPOs have long lists, right? But that doesn't have any real good quality control. So in Ovation Health, we have what's called an open access network. What's that mean? Well, it means we may not have a lot of doctors under direct contracts like the big plans, but the doctors we do have, we've already vetted, and they're high quality and fair priced, and we're willing to, and often, seek out other doctors that are specialists that do things that are also high quality and well priced. So before we say, don't go there, go here, all right, there's a reason for that. And sometimes that's really hard to communicate to a patient that's having a medical emergency, some kind of crisis. We understand that. You're gonna have those things. But you also, like everything else in your life, should really listen to the experts. And we really do want to drive and refer you to somebody that's going to provide you high quality care and at the same time charge you the right price. That always boils back down to what we always talk about. What happens year after year after year when you're in a regular, Blue Cross or United or Aetna plan? What happens every year?
Hopefully you don't use it very often, and your premiums go up year after year after year. They're going to go up 6.45% this year.
Sometimes 8. This year, the average has gone up over 10% per plan. All right? And I know I've said this before, but we've had groups with us since 2018 that have, say it again, never had a rate increase. Never had a rate increase. Which is effectively, if you count 18, 19, 20, 21, 22, 23, now in 24, that's 7 years of a rate decrease.
Yep.
7 years of a rate decrease. Why? Well, because they work with us, appreciate the fact that we're experts, allow us to direct them to high quality care at fair prices. And because of that, we're not only able to reduce their overall spend by 20, 30, 40%, That's part of how we can maintain premiums at a fixed rate over an extended period of time.
And I don't know anybody who doesn't want good medical care at a fair price.
I don't either. I mean, it's weird when you have these conversations because people go, yeah, we ought to be saving money on healthcare. We should do these things. But then when you lay down the choices in front of them, they're still hooked up on the brand. You're like, but ours is better than the brand. I give you a great, we have a relatively small population that we deal with, right? This year, 2024, we have already saved our employer groups over $750,000
Wow.
in the first quarter. And that's it, $750,000. We've saved just one group in this plan almost $400,000 for
And
one procedure.
that's bottom line impact for those businesses.
Right.
That's the money to reinvest into the business. That's the one to reinvest into the employees. The savings are real.
Yeah. What's that mean to that employer group? It means that employer group that saved that $400,000 in claims payment. When we go around to reevaluate them for next year for renewal, we know that they're cooperating with us, they're working with us, they're working with the plan. They probably won't have a rate increase.
Right.
And that's the deal. So, steerage, bad word, good policy, same as referrals. Sometimes get used as a bad word. Really good policy. And I'm going to caveat that by saying if you're working with a plan like ours that has your interest in mind and is working to find you high quality physicians at fair rates. And that's it for this episode of the Poisal Healthcare. Thank you.
Thank you.